Hi friends, in this video I would like to discuss about the radiology of hip. Radiology of hip is most commonly indicated in fracture or acute injury setup of hip and in osteoarthritis or pathological conditions of hip. The views mainly include normal AP view. AP view includes pelvis AP view, means it is actually it includes both the hip AP view. Then lateral is divided into axiolateral, frog-leg view and LAUENSTEIN view. And the axiolateral view is more commonly indicated in injury setting and frog-leg view in pathological condition. Frog-leg view should be avoided in injury as it causes more pain and discomfort to the patient, and there may be a chance of further displacement for the injury. Mainly it is fracture and also luxation. This is the normal AP view which is taken in this particular position. Here in X-ray we can see this like this particular X-ray projection like this. And in this X-ray we can see this is the superior pubic ramus, inferior pubic ramus, ischial tuberosity. This is the acetabulum. Inside the acetabulum there is head of the femur, and here we can see the anterior wall and posterior wall of acetabulum. Here there is ischial spine, and this is neck of femur. This is the greater trochanter, and here lesser trochanter. Whenever we take normal AP view X-ray in internal rotation, 15 to 20 degree internal rotation of hip, then it is possible to see the neck clearly. Otherwise, in external rotation, the greater trochanter will overlap the neck of femur, and the visibility of neck of femur is less whenever there is external rotation of the hip. And in external rotation of hip, we can see the lesser trochanter more prominent than the AP view taken in internal rotation. This is the difference of AP view in internal and external rotation. This is the internal rotation view in which we can see the neck of femur clearly, and here in the external rotation we can see the greater trochanter is overlapping the neck of femur. And also please notice the lesser trochanter is more prominent in external rotation AP view than in internal rotation AP view. Whenever there is neck of femur fracture, there will be prominent lesser trochanter than the normal side X-ray. This is axiolateral view in which the unaffected hip is abducted. In this particular position, with the support of a log or a stone, the unaffected hip is abducted and then the projection is taken, and this is particularly indicated in injury. This axiolateral view is better than frog-leg view in the acute injury of hip joint. Here we can see this is the acetabulum, femoral head, this is ischial tuberosity, this is the greater trochanter, and here this is the lesser trochanter in axiolateral view, which is suggested in injury of hip. And this is frog-leg view in which the affected hip is abducted to 45 degree with the knee inflection, and then this affected leg is supported to the contralateral knee. It is indicated in pathological condition like Perthes disease, and here we can see this is the normal X-ray acetabulum, femoral head, neck, greater trochanter, and then lesser trochanter. This is the frog-leg view. If we are taking bilateral frog view, then it's called as LAUENSTEIN view, which is also indicated in pathological condition, and it should be avoided in acute injuries. This is the frog-leg view. This is another important point, Watt's triangle. In between the trabeculae, bony trabeculae, there is a radiolucent area at the bottom of the femoral neck. Here we can see a radiolucent area, and it should not be confused with an osteolytic lesion. So that is the importance of Watt's triangle, in which in between the bony trabeculae, here we can see a Watt's triangle which is radiolucent, and it is seen at the distal end of neck of femur, and it should not be confused with an osteolytic lesion. Coming to the proximal femoral fracture, in X-ray AP view, we can see the lesser trochanter is more easily identified by the external rotation of the leg when we compare to the contralateral hip. And there will be cortex interruption. A vague dense white line is seen in impacted fracture. 1 in 20 cases of all neck of femur fracture is impacted, and impacted fracture is included as Gardner's first classification, in which a vague dense or white line is seen. And disrupted bony trabeculae in the neck of femur, and disrupted Shenden's line. Shenden's line is an imaginary line drawn from the inframedial border of femur to the superior pubic ramus, and that Shenden's line will be distorted in neck of femur fracture. This is the division of neck of femur fracture. Actually, up to the distal end of neck, it's intracapsular. And this particularly neck of femur fracture is divided into three: subcapital, transcervical or mid-cervical and basicervical, which can be included in the intracapsular fractures. And the extracapsular fractures is divided into intertrochanteric or bedtrochanteric and subtrochanteric. Subtrochanteric means from the lesser trochanter up to the distal end of 5 cm is included as subtrochanteric fracture. And this intertrochanteric and subtrochanteric fracture is included in the extracapsular. And intertrochanteric means it is through the greater trochanter and lesser trochanter. And proximal to that particular part, up to the basicervical part, up to the distal end of neck of femur, it's included in the intracapsular fracture. And it is the division of neck of femur, the fracture of proximal area of femur. Fracture of the proximal area of hip, and in the subcapital fracture is the most commonest in the division of intracapsular fractures. And this particular area of fracture cause avascular necrosis due to the lack of blood supply to this particular part due to fracture. This is the basics of hip radiology, and we can continue with other portions on the next video. Thank you.